Hi, my name is Elise D. Torres, and I'll be presenting the Practicum project, Improving Virtual Leader-Member Communication in a Telehealth Department. The project objectives are practicum organization and site, identifying the problem, project implementation, project outcomes, project sustainability, stakeholder integration and acknowledgement, acquire practical knowledge, and personal professional set goals and integration of the AONL competencies. The practicum organization and site. The selected practicum site, VA James Haley Medical Center, that has been in service since 1972 and located in the city of Tampa, Florida. The medical center provides care services to more than 100,000 men and women and veterans located in Central Florida. With the medical service provided in emergency rooms, surgery center, inpatient care, specialty care, and outpatient care services. One of the outpatient care services provided is the Telehealth Department. The Telehealth Department staff is composed of 47 members. That includes registered nurses, licensed practical nurses, health technicians, and administrative staff. They have one nurse manager and one assistant nurse manager. The staff is also assigned to different work areas within the Telehealth Department that are known as traveling veteran coordinators, remote patient monitoring, clinical video telehealth, and the administrative staff that are located in different clinic locations. Their main method of communications is utilized via computerized technology approved by the Veteran Administration software application called Microsoft Teams that allows secure video conference calls or meetings. Also, the second method is the use of cell phones that are approved and provided by the VA. The Telehealth Department provides various virtual healthcare services, utilizing video camera appointments for the clinical video telehealth, remote patient monitoring, and at times for the traveling veteran coordinators. The video appointments are mainly coordinated by the primary physician or staff to the specialist. The veterans are assisted by a staff registered nurse, a licensed practical nurse, or a health technician. The services are available in different clinic locations to veterans that are at a far distance to the main medical center campus. The outpatient clinics are located in 4 counties, being Hillsborough, Pasco, Hernando, and Polk County. The 7 outpatient clinics are Annex, Brooksville, Lakeland, Lecanto, Newport Richey, Riverview, and Zephyr Hills. Identifying the problem. The problem was identified as a communication and engagement issue. Utilizing Microsoft Teams application in the daily morning huddles, the observation was made from the staff nonverbal communication by observing their facial expressions, not showing engagement or interest in the morning 15-minute huddle. Another observation was made that the staff felt more comfortable approaching the assistant nurse manager, since the assistant nurse manager has been part of the department for over 10 years, and the excellent knowledge skills in the programs. In addition, the assistant nurse manager is very approachable by showing excellent servant leadership styles with the staff. Other factors to consider are the nurse manager has only been in the department in that position for 3 years, and the knowledge for the telehealth program is very limited. To add, the staff are located in different locations or in different clinics, not having the opportunity for that face-to-face interaction and knowing the staff well. Project goals. The project goals are to create a culture of change by implementing resources to improve the leader-member exchange communication, the relation, and a healthy work environment. Utilizing the leader-member exchange theory that is a social, emotional in nature, and it progresses from being a relationship between two strangers to a relationship between two acquaintances, and eventually a mature relationship. Also, the center of the theory are the leader and follower roles. The exchange relationship that develops between them and the trust that exists between pair of people within the work situation. The three main tools are to utilize the trust inventory and sponsorship. The leader-member exchange theory identified 4 key features that are growth, investment, focus, and integration. The theory to be successful and of which must be integrated for leadership making to occur. Project implementation. The presentation was scheduled by the assistant nurse manager utilizing Microsoft Teams applications and organized in 4 meeting sessions. The first session started at 8 with the clinical video telehealth staff. The second session was with the remote patient monitored home telehealth staff. The third with the administration staff. And the fourth meeting was at 11 in the morning with the traveling veteran coordinator staff. Subject matter included in the presentation was the definition of leadership, what are different types of leadership, what is the leader-member exchange theory, and the use of evidence-based practice in nursing leadership. Staff reacted very well to the presentation. Questions were answered. And after the meeting, an email was followed by the PowerPoint presentation attached. Also, written material that included the definition of leader-member exchange theory and the nursing EBP journal that was researched. After the first email, a second separate email was sent from the SurveyMonkey website application that included the anonymous survey questions to the staff. The survey included questions for the staff, understanding of what is leadership styles, the staff perception of their nurse manager and leadership styles in the department. It also asked the suggestions they had for improving the communication and engagement in the department. Project outcome. 46 invitations were sent utilizing the website application SurveyMonkey. 29 of the staff responded. Only 17 telehealth staff did not respond. This is a 63% response from the staff toward their view and opinion of their department leadership. The majority of the staff expressed satisfaction with the nurse manager and assistant nurse manager leadership styles. Project sustainability. The project sustainability is possible if the telehealth department staff agrees to commit, participate, and engage in the improvement of the leader-member communication process. If the practicum project is not sustained in the telehealth department, this one-time practicum project approach can provide reference and guidance for future interests of the staff to implement communication improvement. Stakeholders integration and acknowledgement. Practicum project integration was positively received and accepted by the nurse manager and telehealth department staff. The SurveyMonkey questions and Microsoft PowerPoint project presentation was received and discussed with the nurse manager and assistant nurse manager before presenting the project to the staff. Both managers voiced out their opinions and suggestions and improvement needed for the project. Acquire practicum knowledge. The last 16 weeks of the practicum course, I gained a tremendous amount of knowledge in my nursing profession as a future leader and as a human being. I was able to observe the interaction of the nursing staff members with their manager in a different perspective by not being part of the nursing staff. This provided me the knowledge that to be a great leader, I have to set a great example to the nursing staff. Being a leader takes a great amount of commitment, responsibility, organization, wisdom, patience, empathy, and courage, emotional intelligence, and flexibility. I will say that leadership is the calling of God to his strongest warriors. Personal professional set goals and integration of the AONL competencies. A personal goal is to never lose sight of my vision, to implement change, and to be a servant leader for others. Be the best version of a leader I wish I had the opportunity to meet in my professional career. Also, my AONL goals are to master the knowledge, the skills, and ability to associate with the anchoring the domain leaders within. This is the American Organization Nursing Leader Core Competency Model Framework and anchors 5 core domains, which is professionalism, communication and relationship management, knowledge of healthcare environment, and business skills and principles. All 5 core domains and anchors in the leader within. Quote by Mr. Tanvir Nasser. Leaders need to show they believe in their employees' potential to be more than they are today. Any questions?